All right, so this is the day in the life of Dr. Michael Lacey. I generally start my day off about 5:30 in the morning, and then I go directly to meditating. I need to meditate. I have to get my head straight for the day, and when I put my hands on people, I want to make sure I'm in a good space for that. After that, I like to put on my podcast. I'm always learning, always continuing to feed the mind, shave, try to shave, not every day, but try to get clean shaved. I take a shower, do a warm shower, then a cold shower, at least three to four times a week. I decided to put on the blue today, hoping to match with Dr. Amir, because that's what we do. And then I want to make sure every day I do my apple cider vinegar. I do that twice a day. Been doing it for months. I hate it, but it's good for you. Try to step out of the door by 7:10. It takes about 10 minutes to get to the office. I do my best to try to be one of the first ones in. There's something about being in the office before everyone else is there. It's kind of zen-like. I'm really big on headspace and keep my energy right. And then I open up Chiro Touch, check out the schedule to see who's on, and I also want to start looking at numbers and preparing for our pre-shift, right? Because we want to make sure that that we're all on the same page before the shift starts. And this is the lovely group here. They all look so excited. Even Aspen does too. But she tends to perk up when patients come in. So we do this to make sure that if there's any issues or any patients that need any extra attention, we make sure that that's taken care of before the shift starts. Before we leave, we want to pump up everyone. So we have our little special handshakes, and it's adjusting time. And the best part of being a chiropractor is helping people. At the end of the shift, people often ask, do the doctors get adjusted? Absolutely. We adjust each other all the time. Each at the end of the day, sometimes it's at the end of a shift, but we adjust each other. We have to practice what we preach, right? And then during the lunch break, I eat my lunch. Oftentimes it's paperwork or meetings. Today we're just doing this paperwork and preparing for the second pre-shift that starts at 2:30. And then we have more adjusting. Then we usually finish adjustments about 6:15. And this day I actually had a mastermind, a Zoom meeting. Right after I finished adjusting, I had to go on to Zoom and we meet with other chiropractors to kind of continue to grow, continue to hone our craft. Then after that, I do some paperwork, and then I'm finally done for the end of the day. That's usually around 8:30 or 9 o'clock. So that's the day in the life of me.